This video is about SI joint symptoms or sacroiliac joint symptoms, or said another way, symptoms associated with sacroiliac joint dysfunction. As a chiropractor, I've helped hundreds and hundreds of people that presented to my office with back pain and hip pain and leg pain associated with the sacroiliac joint by adjusting and correcting the sacroiliac joint area. So in this video, I'm not only going to describe some of the most common symptoms that are associated with SI joint, so SI joint symptoms, but also I will show you at the end of this video some key techniques and chiropractic adjustments that you can look at on how we actually help correct symptoms associated with sacroiliac joint. Hi, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to strengthen and stabilize your back and even correct your spine with non-surgical techniques. Like this, you can bend, move, and lift normally without pain and limitation and do all the things you want to do in life free of pain and limitation. So if you want these tips and strategies, be sure to subscribe right now by clicking on that red button below. Tap on the notification bell. Like this, you don't miss out on these weekly video updates. If you've been following my videos, you'll know that I will usually show some spinal models or anatomical charts to describe the area of what the video is about. So this video is about the SI joint or sacroiliac joint. So the sacrum is at the base of the spine. It's a very, very important piece of spinal anatomy. The entire spine sits on it, so it needs to be positioned properly to avoid other spinal distortions. I won't get into that just yet in this video, perhaps in a future video. Here is the ilium. It's one half of the pelvis. Here is the other half of the pelvis is the ilium, and together it makes the entire pelvis with the sacrum. So the sacroiliac joint is the articulation of the sacrum and the ilium. So there's the sacroiliac joint here and the sacroiliac joint here. Now, the sacrum is actually a very secure bone inside the actual pelvis. It's very stable, and it's attached by a multitude of ligaments on the back side and also on the front side. And there's other muscle groups that through the pelvis and different regions of the upper thigh and hip and the sacrum and the pelvis attached to the sacrum as well. So there's a multitude of actual tissues that can be inflamed and irritated in an SI joint dysfunction or a sacroiliac joint dysfunction. I'm going to use this anatomical chart to explain the symptoms associated with SI joint dysfunction or SI joint symptoms. So here's the pelvis again, right here. And if you look closely here, you'll see there's some white tissue here. That represents ligaments. So the ligaments, they connect the sacrum with the pelvis. There's also ligaments here that connect the ischial tuberosity of the pelvis to the sacrum. And then the muscles here of the thigh, they connect to the pelvis also. And any one of these muscles can actually affect sacrum and pelvic issues. But when there's SI problems, dysfunction in the SI joints, dysfunction in the sacroiliac joint, here are the most common symptoms. One, there can be pain, local pain, point tenderness right at the sacroiliac joint. Oftentimes the patient will tell me, "Doc, I have hip pain." And then I'll ask them, "Well, point to me where your hip pain is." And they are not pointing at the actual true hip joint. They're pointing at the buttock area, just above the sacroiliac joint area, right over the sacroiliac joint, that SI joint. And that's not really the hip, but that's what people think is the hip. So when people tell me about hip pain, I need to rule out a true hip problem and then hone into the sacroiliac joint, okay? So that's one of the actual symptoms that people tell me that already begin to clue about SI joint problems. Now, the SI joint will commonly refer pain, not radiate pain, but refer pain down into the thigh and up until the knee, but not past the knee. That is not sciatica. People sometimes will tell me, "Doc, I have leg pain and sciatica pain." Then I'll ask them, "Well, does your pain go right down to the foot, into the toes, or does it stop at the knee?" And they'll tell me it stops at the knee. Well, that's not a true sciatica pain. They'll also describe it as a dull, achy type of pain versus a radiating nerve electric shock type pain or numbness tingling type pain. So these tissues here will create sclerotogenous referral patterns, and the SI joint will refer in the back part of the thigh down here up into the knee area. So that to me is a classic sign of sacroiliac joint dysfunction. Now, one of the common triggers of SI joint problems is a lot of sitting. Sitting a lot will actually compress on the pelvis and cause it to stress the ligaments here of the sacrum and can actually irritate that sacroiliac joint. So sitting tends to be one of the mechanisms of at least aggravation for a sacroiliac joint problem. Sometimes the SI joint, when inflamed, can actually refer pain into the groin region for either male or female. So that can cause pain not just in the back part, but also in the front part below the pelvis into the groin region. And the sacrum is one of the common areas that gets misaligned or subluxated. It's one of the most common areas that I actually have to correct in the office. When we correct the sacrum and adjust the sacrum, it actually improves SI joint symptoms and SI joint related pain very, very well. We've helped hundreds and hundreds and hundreds of people correct the sacral problem that triggers SI joint symptoms. Over the last 20 years, I've seen many, many people that we've been able to help with chiropractic care. And if you want to see some of these actual techniques, I actually put a video for you right here to go watch where I demonstrate chiropractic adjustments for the sacrum, several different types of actual chiropractic adjustments to help with the sacrum, and these adjustments may actually help with SI joint symptoms. Go ahead and watch that video right here, right now to watch those adjustments.